Good evening and welcome to Seva Canada's 2025 Annual General Meeting. This has been a milestone year of growth for Seva Canada, new programs, expanding partnerships, tens of thousands of lives transformed by the power of sight. But none of this happened by accident. It happened because of you. I'm Marty Spencer, co-chair of Seva Canada Board of Directors, and I'll be emceeing tonight alongside our vice chair, Harinder Dhillon. I'd like to start by acknowledging that I'm joining tonight from the traditional, ancestral, and unceded lands of the Snuneymuxw and Snuneymuxw peoples. The Seva Canada office is located on the unceded, traditional, and ancestral lands of the Musqueam, Squamish, and Tsleil-Waututh peoples. As an ophthalmologist who volunteers in Seva's programs, I'm the lucky guy who gets to see those world-brightening smiles from people who just recovered their sight. Knowing that our work depends on you, everyone attending tonight's AGM and all our supporters throughout Canada and beyond, I'd like to thank you on behalf of all those smiles. We couldn't do it without you. Thank you all so much for being a part of Seva Canada.
All right. So
over to you, Harinder.
Thank you, Marty. Thanks for joining us on Zoom this year. We have moved our AGM to Zoom only to be inclusive to people across the country and those who face accessibility issues to attending an in-person event. On your screen, you will see our agenda for our first hour together. For the first portion, you'll hear from our staff and partners about how your support over the past year has helped so many people see in more places and our plans for the future. The second half of our evening, we will take care of the financial business and board elections to fulfill our obligations to our membership as part of the BC Societies Act. Please note that this meeting is being recorded. If you second a motion or have your camera on, your name and image may be in the recording. And to ensure a smooth flow for our hour together, please remain on mute. If you have any questions, please put them into the chat, and we will have time at the end of each section to address as many as we can. And if we can't get to all of them, we will do our best to follow up with you offline later. So since we are meeting virtually today, we will be using Zoom's polling feature to record votes on each motion. So this allows eligible voting members to cast their votes securely and easily. Per our bylaws, a member of Seva Canada is anyone who has donated $20 or more over the past fiscal year. So I'm going to call several motions this evening, which have all been shared in advance via email to anyone that RSVP'd to the event. If you would like to second a motion, please select the raise hand feature within Zoom, which will be at the bottom of your screen. So I'll give you a quick tutorial on how to vote. So in just a moment, a poll window will pop up on your screen, and you'll see a question with multiple choice answers. To participate, simply click on the option that best represents your choice. Now, if you're on a computer, the poll window should appear automatically in the middle of your Zoom screen. And if you're on a mobile device, it may appear as a pop-up at the bottom. So just tap your answer and submit. If you're having any issues, once again, please message in the chat and a Seva staff member will reply directly and help you. So once you've made your selection, don't forget to click submit at the bottom of the poll window, and you'll have about 30 seconds to respond. So we're going to test this out with an easy one, our first motion. So I would like to propose a motion to approve the minutes from our last AGM held in November 2024, previously circulated via email. At this time, I would like to request a seconder indicated by raising your hand. Thank you, Bridget. And now we are going to vote. So if you can please select your response and remember to click submit. The vote will happen automatically and the results will show on the screen in a couple seconds here. Okay, and the motion is approved. With that, I'd like to turn it over to our Executive Director, Liz Brandt. Thank you so much.
Hi, everyone. I'm Liz Brandt. I am so pleased to see everybody here on Zoom this evening. I want to start out by joining my colleagues by saying a huge thank you. So this year, Seva Canada has grown really more than ever before in its history, and it is because of donors like you. We are reaching new communities in Peru and in India. We are expanding our programs in Cambodia and in sub-Saharan Africa and helping our partners in Nepal and India improve their care and increase their impact through our evidence and practice work. And thanks to you and to our amazing partners over the past year, 1,424,830 people received eye care services, and 104,350 people received sight-restoring cataract surgery. So really, on behalf of all of these patients, thank you so very much. So everything we do is in service of our patients, and I wanted to take a couple minutes just to share a patient story that I think does a good job of illustrating how Seva Canada uses donor support to serve our patients with eye care through our 3 pillars, which are equity, quality, and self-sufficiency. Equity is getting care to the people who lack access, quality, ensuring that they receive the best possible care, and self-sufficiency, which is giving our partners the tools that they need to do this themselves. So earlier this year, I had the privilege of visiting our partners in Cambodia. And while there, I had the chance to visit with the team and meet patients at Bante Mianche Eye Unit in the northwest of the country. And at the eye unit, I got to meet MSEC and her husband, Kautlom. MSEC is in this photo on the right, Kautlom is on the left. And these folks are beloved elders in their rural community, and they're helping to raise their grandkids, just like many grandparents are doing all over the world. But also, like many grandparents and anyone who lives long enough, they developed cataracts. And in Cambodia, older people who lose their sight to cataract often don't get treatment. They live with vision loss, even when care is provided for free at the hospital, like it is at Bante Mianche Eye Unit. That's because they face multiple barriers to care. They live far away in rural areas without transportation. They might not be aware care is available. They may be afraid of surgery or worry that the time spent accessing that care is going to be a burden to their families. And that was the case for MSEC. She had been suffering from blindness needlessly and wasn't able to do the things that she loved. She couldn't play with the grandkids. She couldn't visit the pagoda. And that was until last year when she had cataract surgery through Bante Mianche Eye Unit. And thanks to the care she received, funded by Seva Canada donors, her vision returned, and so did her ability to play with those grandkids and get around independently. But when we met her, she was back at the eye unit again, but it wasn't for her. She was now helping her husband get care because he was now experiencing vision loss from cataract. And we spent some time sitting with MSEC while waiting for her husband's surgery, and she was just absolutely the life of the party. She was full of laughs, joking with the staff and the other patients. It was a really beautiful way to alleviate the nerves that some of the other patients were feeling, anticipating their own surgeries. And it was just, you could see she knew firsthand how powerful and life-changing the gift of sight was, and she just wanted everybody around her to experience too. It was amazing to be with her. So I want to talk a little bit about how did she get here. And the first piece of that is the pillar of equity. So MSEC and Kautlom would never have made their way to that hospital on their own if it weren't for the Seva Canada outreach worker who traveled on his motorbike to find them in their rural village. You'll see on the screen, this is Rayuk Bune, and he has been a Seva field worker since 2012. He is just the sweetest guy. He's gentle-natured, he's kind, and he's also an expert at counseling patients to encourage them to accept care. He rides on his motorbike every day to reach remote areas and perform eye screenings for rural communities. And he and others like him are responsible for making sure that all patients have equal access to care, no matter their means or where they live. So, and then the next piece is quality. So MSEC wouldn't have been so overjoyed with her outcome if it weren't for the skill of the ophthalmologist who performed her surgery. This is a photo of the lovely Dr. Barang. So his dedicated team is also highly skilled, and that good outcome is also the result of the high quality donor-funded equipment and surgical consumables that are provided through your support. And in all of our programs, we ensure that surgical outcomes are monitored to make sure they're meeting World Health Organization standards. So patients who get care are seeing really well, like MSEC. Finally is the pillar of self-sufficiency. So this is a program run by Cambodians for Cambodians. And what we have here is a photo of the Seva Canada Cambodia team. These three are experts in eye health delivery. They're there to mentor our programs, help them work with data, and really provide them with everything they need to deliver care really effectively. They've also worked with the local government in Cambodia to develop a cost-sharing model where Seva Canada covers 70% of the hospital's costs, and the Cambodian government contributes the additional 30%. So in all contexts where it's feasible, we do try to establish local revenue streams and cost sharing in the hope that one day the need for foreign aid to sustain these programs is reduced. And so here we are back with MSEC and Kowloon. And there's those beautiful smiles. There are over 100,000 patients just like these folks who had their lives changed forever last year thanks to cataract surgery supported by Seva donors and our partners. And I just want to say thanks again. So my colleague Katie is going to tell you a little bit more about some of our program highlights over the past year, but I'm just going to take a minute or two to speak about what's next for Seva Canada, because our team has been reflecting on these pillars and also talking a lot about where we came from. So Seva was really born out of a very unique mix of heart and science. The word seva means selfless service in Sanskrit, and that concept was at the core of our founder's vision for the organization. Some of our founders are pictured here in this lovely photo from the 80s. This group was inspired by the countercultural energy of the 1970s and a belief that selfless service without ego was a powerful and even radical way to make the world a better place. But at the same time, our work was also shaped by scientists and public health leaders who brought a really deep expertise and a focus on maximizing impact. So our work was shaped by the intersection of this kind of soulful intention and scientific rigor and compassion meeting impact for bringing together to deliver the power of sight. And over the years, Seva Canada has grown and evolved, and many people have played a hand in the direction of our organization. So board members, staff, volunteers, and supporters, everybody bringing their own mix of head and heart. And that balance continues to shape how we work and how we move forward. And a big part of that is listening. So listening to the communities we serve is always going to be at the heart of what we do. Because if we are being of true service and Seva, their voices really have to guide our decisions. And just as an aside, I have 2 little kids, and I often find myself repeating a message to them that I think we're also striving for at Seva, and it's help in the way you're asked to help. And it's a simple message, but sometimes it's hard to do. So this fall, we have kicked off a strategic planning process to guide our work over the next 3 years. We've asked for feedback from our partners to find out how are we doing, How are we serving them? What opportunities are there for us to do more? And now we have a chance for the staff and board of Seva Canada to come together, reflect on our journey, and make a plan that builds on what we've learned. So thanks to all of your support and believing in our vision, the vision of a world in which nobody is needlessly blind or visually impaired. And I'm so excited to share with you in the next phases of delivering on our mission. And look who's popped up. It's Katie. Um, Katie, Seva Canada's intrepid program operations director, is going to share with you now about some program highlights over the past year. Over to you, Katie.
Thanks, Liz. So I have the immense privilege to share some of the highlights of what our program partners have done in the last year. Thanks to your transformative gifts this past year, we were able to expand direct services, including surgery, glasses, and medicine, to 2 new countries. We also increased our levels of support in all other countries, and we've grown our evidence and practice program, which I'll talk about in just a minute. So I want to start with our newest program in Peru. So this past year, we launched a new program in partnership with Clínica, Oftalmológica, Divino, Niño, Jesús, where we're supporting outreach and surgical services to people in the Loreto and Lima regions. You'll hear much more about this program in just a minute from its director, Alberto Lazo, who's here with us today. Our next program that we started is in India, in the Punjab region, with the ophthalmology unit of Dayanand Medical College and Hospital. This program has 2 main focuses. The first is to provide low or no cost pediatric eye care services, including glasses and surgery for babies and children. And the second is to create 5 community eye care centers over the next 3 years to provide regular access to primary eye care for anyone who needs it, regardless of their ability to pay. This program is being mentored by Shroff's Charity Eye Hospital, one of the leading eye care providers in North India. Our next new program, which is in partnership with the Kilimanjaro Center for Community Ophthalmology, is with the pediatric ophthalmology part of the Mbeya Regional Hospital. So this new pediatric program is the first to provide low or no cost eye care services for children in southern Tanzania, eliminating the need for long and expensive bus rides to other programs in the northern part of the country. As of the end of this past fiscal year, Seva Canada supports 42 hospitals in 9 countries and an ever-growing network of over 100 community eye care centers. We support our partners by providing them with what they need to provide high-quality eye care services to the people in their communities who need it the most. How do we do this? We do this by asking them what they need. This very simple question of what do you need starts the process of each partner having the resources and trust to build effective eye care programs that are carefully created to eliminate the barriers that each particular country's people face in accessing eye care services. While no one program is exactly the same, they often include training of local people to identify common symptoms of vision loss and provide referrals. So these people could be school teachers, they could be small business owners, community health volunteers, general doctors. We also provide funding for outreach activities to meet people where they live in remote areas, transportation to and from hospitals, and lodging and food as needed while receiving care. We provide glasses, consumables, medicine, and equipment for all partners. And we also provide training support for more eye health personnel at all levels, from community eye care center staff to subspecialty residencies for ophthalmologists. And this is to ensure that global quality standards are met for all of our eye care services. Finally, We are very proud to support operational research for our partners to help them build the skills to become more effective at providing high quality, high volume eye care services. Operational research is the study of system improvement. In this case, it's the study of various aspects of the eye care system and how it's delivered. This program, led by Dr. Ken Bassett and Priya Reddy, has two main partners, both located in India, LICO and Prasho. This past year, both programs initiated operational research training for 12 hospitals in India and Nepal, covering topics ranging from cataract surgical quality to increasing the number of people who show up for services at the base hospital after being referred from a CEC. Both programs are aimed at training staff at each of the hospital in the foundations of operational research while applying it to one particular topic. This is done on purpose so that all hospital leadership can understand the tangible benefit of operational research through increased patient reach or increased quality of services, while also allowing the staff trained to then have the skills necessary to apply operational research to other areas of service delivery. Now, to give you a more in-depth look at how our program partners provide eye care, I'd like to introduce Alberto Lazo. He's the Chief Executive Director of Clínica Oftalmológica Divino, Niño, Jesús in Peru. Alberto's been with D&J since 2005. An engineer and business administrator by training, he specializes in project management, healthcare management, business organization, and strategic planning. In addition to managing and running D&J, which is a full-time job all on its own, he also leads various institutional improvement initiatives for other hospitals in Latin America. We are so excited you're here, Alberto. Thank you.
You're here.
Oh, thank you. Thank you, everybody. Hi, everybody. I'm Alberto Lazo, Legua, Executive Director of Divino Niño Eye Hospital, Peru. Next slide. Well, some basic data of my country, Peru. Peru has a population of nearly 34 million people, of which an estimated 4.7 million have vision loss, 226,000 of whom are blind, according to last data of IBB Vision Atlas. Peru, between 26 and 29, the Peruvian economy is expected to grow by an average of 3.2. However, there are concerns about this rate, which is considered not enough for the country's development. It's supposed that we should double that. Why? Why? Because it's a very simple reason. By now, poverty in Peru is nearly 30%. Previous pandemia, the scenario was a 20% of our work done through the last 20 years, perhaps, no? So that good expectation that we have as country is not enough to return to a 5-year back scenario, no? There is a political instability since 2016, but I think that we have quite accustomed to deal with that. Citizen insecurity has become maybe the country's main problem in the last 2-3 years, no? Divino Niño has eye care facilities in Lima region, the capital city, in which there is the capital city, and Loreto, the Amazonas, the rainforest of Peru, no? In these two regions, Divino Niño has 5 eye care, has 1 eye hospital in Lima and 4 vision centers. And in Loreto, we have a 2nd eye hospital and 1 vision center. Why Loreto? Loreto by now is one of the 2 poorest regions in Peru. In these 2 regions, Divino Niño impacts directly. But we also have a building capacity unit in which we lead another social eye care problems, maybe the main ones of important regions of Peru like Piura, La Libertad, and Cusco. In each region, there is a population between 2 million, 1.5 million. By now, I can tell Divino Niño is trying to cover the main cities of my country. Please, next slide. So Divino Niño is a non-profit organization. It was founded in 1999. In 2005, with the support of CVM Germany, we built our first eye hospital. Then we continue doing our outreach programs in the highlands of Peru, then the rainforest of Peru. And after 5 years of intervention in Loreto, with the support of CVM Switzerland, we were able to build our second eye hospital in 2016. Since 2022, we have started implementing vision centers, these eye care facilities in a primary level of general ophthalmologic eye care attentions. We have completed by now 5 of them. And well, amongst the main achievements of Divino Niño, we are approximating to 1 million attentions, 30,000 cataract surgeries, and more than 1,500 outreach screening activities for elder people and for children. Next slide. The patients of Divino Niño, the focus of Divino Niño is south part of Lima. And in this socioeconomic pyramid of Peru, we can see that our patient comes from C, D, and E. Adding this percentage of people is nearly 90%. That is our focus. That is our focus. I can say that type of patients are our focus. South part of Lima is our focus. Prevention of blindness is our focus. Next slide. Some basic characteristics of each one very quickly. Patients that come from class C have some job stability, have a home, higher school or higher education, nearly access to most basic services, including health services, but probably a health service that can come from the public sector. And in the public sector, by now, there are 2 main characteristics: long waiting list, no medical supplies. Patients that come from from D, are informal, are poorly paid, high school completed almost, very limited access, including health. Class E, very low income work, no stability, precarious or low materials in their homes, or no home, incomplete primary education, very limited and informal access, or known as access to basic services. Next slide. So, going into the access to an ophthalmologic consultation, there are main barriers that our community are facing. Cultural, no prevention, it's still here in my country. Governmental, eye care public services. I have just tell, long waiting list, no medical supplies, not necessary good results of their services. Economic, I can say that is a barrier because, for example, there are private services, very good ones, but of higher prices, not accessible to the large community. Lack of awareness And we have identified certain like also of family interest, for example, in the cases of children. Our large experience has been in elder people, but and children we have just started 2-3 years ago, but we are finding that also is certain lack of family interest in the case of children, not necessarily perhaps in Lima, but in the other cities of Peru, yeah, for example, in Loreto. Next slide. What are the actions that are taken by the clinic actually, by Divino Niño actually? Well, we are opening vision centers, eye care facilities of primary eye care level, ophthalmologic attention there. We are decentralizing our job of the base hospital, and we are trying to cover and doing a very strong network of in all south part of Lima, 2 million people. We are implementing and upgrading our ophthalmology special exams center. Yes, because some special exams, some special images are not available to everybody in a reasonable price, in a social price. And Divino Niño is doing that, is offering that. We have reactivated our community programs focused in elder people and in children. We are promotion and dissemination of visual health content, and we are trying to more differentiated social cost for community care groups in vulnerable situations. No, in general, our prices, as we say, is are social prices, but also we are trying to offer less than that, and inclusively, in some cases, a free service to some a specific group of patients. Next slide. Divino Niño and Seva Canada, since last year, that we started running some projects and some interventions. We are doing special surgeries, major surgeries, not only cataract, also we are attending another emergent pathologies like retina, like glaucoma, and we have been able to do that thanks to this project with Seva Canada in the base hospital in the Lima hospital. No, it has been our first project attending that kind of patients. I want to highlight that because I'm not talking only of cataract. I'm talking also of giving the opportunity to patients that are not going to find another social fee in these cases of retina and glaucoma, for example, no? And we are able now to do that, no? In some a specific quantity of patients, but we are just starting, no? And really that is giving us a lot of branding also, because I can tell you now there are coming patients not only of Lima regions, of the other regions are coming to Lima looking for that option, no? Divino Niño historically, yes, we have been we are a reference center in cataract in my country, not only in Lima, in my country, but now we are turning that scenario also with the other emergent diseases. In Quitos, we are running a project very interesting of cataract surgeries done for that patients that come from small villages, that patients that have to go through rivers, no? And we are screening them, and we are taking them to Iquitos, to our facilities. We are able, thanks to this project, to do them a complete eye care attention, including finally the cataract surgery. In Iquitos, By now, we are only doing cataract because that is what we are able to do that due to basically technology and equipment. No. One small case story here in our first trip to a community called Tamshuyaku, in which we used to go 10 years back. They identify us and they told us that they were just waiting for us because no one is going to take care of that cases, no? Of that cases. And well, we return after nearly 10 years and we want to continue doing that kind of intervention. Next slide. What comes next for Divino Niño and what comes next with the support of Seva Canada? I think that continue doing this attention in the rainforest of Peru, in Amazonas, in Loreto, continue working and doing activities for children. There is one major big step next that is we are doing screening, we are attending children, but in a clinical side, not in a surgical side, and that's one of the things that we want to complete next year. We want to be able to see more people there in Loreto. We want to see also more people in Lima, be able to be able to attend more people in Lima, for example, be able to have a major install capacity, no, because by now we are nearly full in the hospital we have, and that's why, next slide. And that's why we are by now in Lima in a very big project. You can see at the left side that DNJ Clinic Lima currently, no, and our project for 2027. No, we are thinking into try to increase our facilities, increase our capacity, try to look for more people. They are looking us, and we want to be prepared for that, no, with an eye care, very efficient, very secure attention for them, no, but maintaining our social purposes as 20 years back when we started, no. Thanks.
Thank you, Alberto. That was a wonderful presentation. Really appreciate you sharing with us about your work and our partnership and all of that support that comes from our donors on the call today. Thank you so much. We've got a couple minutes. If I'm just gonna have a quick look in the chat to see if any questions have come through. If anyone would like to pop a question into the chat for anyone who has spoken so far, I'm happy to help facilitate for a couple of minutes. I'll just give one moment for any questions, and then we can move to our next section. Okay, it looks like everything was crystal clear. Thank you. Oh, Sunil, if you have a question, why don't you go right ahead?
Not a question, just want to appreciate Alberto, a good friend, and the team. It's very heartful to see the enhancement in the way they reach out to people and then add value to the eye care initiatives in Peru. Congratulations.
Thanks, Sunil. That's great. Okay, well, I think now is the time to move into the second part of our evening. Thanks again, Alberto. So we are now very lucky to be joined by Angela Sartori of RHN, who is our auditor, and she is here to present our Seva Canada's financials. Thank you so much, Angela, for joining us tonight.
Thank you. Thank you, Liz. Thank you. So I'll start off with these are the snippets from the audited financial statements for the year ended June 30th, 2025. The first section outlays the revenue from the society. So we ended 2025 with $4,992,931. Just below that is a section expenses. These are, and they're grouped into program payments, program administration, fundraising, general administration, for a total of $4,055,444. This year ended with an excess of revenue over expenses of $923,514. We're able to move on to the next slide. And this is the statement of financial position. So this is the balance sheet. It lists all the assets and liabilities of the society. So the first section is current assets. We start with the cash, investments, GST, HST, prepaid expenses, inventory. That totaled up to $2,806,000. Long-term investments, $5,154,736. Tangible capital assets, $13,085 for a total of $7,974,221. Moving down, we have current liabilities, accounts payable, $23,336. Due to government agencies, $504. Salaries payable, $24,936. Deferred revenue, $5,218,775. For total current liabilities of $5,267,551. For total liabilities and net assets, $7,974,221. Moving on to the next slide. This is just a breakdown, more detail of the four expense groupings. So this is the details, the program expenses. Next slide. The next schedule will include the fundraising expenses, general administration expenses. And moving down a little bit to the next schedule. And yeah, so general administration, $341,261. And moving to the next slide.
That's the last slide that we have for you.
That's the last slide. Perfect. And yeah, this slide just gives us sort of a detail of the other expenses on the first page of the financial statements.
Great, thank you, Angela. So I'm going to just provide a couple of comments on behalf of management to follow up with on Angela's presentation, and then afterwards we can take any questions before the board puts forward a motion for approval. So as you saw from Angela's presentation, Seva Canada is growing, and last year our revenue grew by 64%, and that is thanks to the generosity of folks like yourselves, as well as proceeds from our investments. And because of this, we were able to significantly increase our program spending. Last year, our programs accounted for 81% of our expenses, and 11% was fundraising and marketing, and 8% on administration. And also to point out, as Angela reviewed with you, having raised about $5 million, spending just over $4 million. We added $923,000 to our reserves. And I just want to note that Seva Canada has a spending plan for the significant funds received and not yet spent. This is outlined in the notes to our financial statements for some of those significant revenues. And that's why it's showing up as a deferred revenue. So we are supporting a set of strategic initiatives, which are partially to support Seva Canada's sustainability and also our program expansion. And that is over the course of the next 4 years. And the objective of that is to try to balance prudent financial planning with a recognition that people are blind now, and it is our mission to serve these people and the very real needs that are urgent to them. So I just wanted to make sure that you folks had those comments before our board introduces approvals. So are there any questions for myself or Angela or anything else that was prior in the evening that you'd like to ask? I'll just pause for a moment to see if anyone would like to chat a question. And if something occurs to anyone later, you can always feel free to send us an email, and we're always delighted. Email or call our office. We do pick up the phone. Always delighted to connect. Okay. If there are no questions, then I'm going to, oh, there we go. I'm going to hand the microphone back to Harinder Dillon, our vice chair, to take care of some motions. Thank you, Harinder.
Thank you, Liz. So with that, I would like to request 3 motions. So firstly, I would like to propose a motion to approve the 2024/25 audited statements. And I would like to request a seconder indicated by raising your hand. Thank you, Marty. And now we will vote. And please remember to click submit. Just waiting for the results. And the motion is carried. Secondly, I would like to propose a motion to approve the appointment of RHN to be our auditors for the upcoming year. I would like to request a seconder indicated by raising your hand. Thank you, Bridget. And now we will vote. Remember to click submit. Just waiting for the results. And the motion is carried. So the last formal piece of business for tonight will be our board elections. Our board slate is on the screen. So I would like to propose a motion to approve the board slate. And if I could please request a seconder indicated by raising your hand. Let's see. Thank you, Jill. And if we can vote. Just waiting for the results. And the motion is approved. Thank you. And now I'll pass it back to Marty.
Thanks, Harinder. And now, on behalf of the board, I'd like to do a few thank yous. I'd first like to thank Seva Canada's amazing staff who have put this evening together and who run our organization with expertise and heart. And I can assure you they're an absolute delight to deal with. I'd also like to thank Seva Canada's donors who are having their 25th year anniversaries. Thank you all for your commitment. And thank you to all our volunteers who help us in so many ways. And a special thank you to a volunteer who has been a miracle worker for us, our volunteer management consultant, Sheila Moynihan, who over the years has traveled to Cambodia, Nepal, and Tanzania to mentor our programs. Most recently, she interviewed each and every program partner, staff member, and board member to help us build an inclusive and responsive strategic plan. She's a trusted advisor to our board and staff and the true spirit of Seva. Sheila, thank you for the countless hours, for your commitment, your intelligence, and your spirit. Lastly, there are two special donors I'd like to recognize who passed this year. They both made transformational contributions to our organization in their lifetimes. One is Mr. Rod Sodmont, who left us just a few months ago and who gave very generously to Seva. The other was so humble that they've always wished to remain anonymous. We as a staff and board will never forget them. We'll honor their legacy through the sight of others. As we look to the future, we know that vision care needs will require us to evolve and grow. But tonight reminds us that we have the foundation we need, a community of supporters who are passionate and committed with us in this mission. Thank you for being part of Seva Canada. Our partners, patients, and staff from all over the world want to say thank you as well via this special video message. We will adjourn after this this video. Thank you so much.
Hello, my name is Barang. I'm an ophthalmologist in the team in Peru. Thank you very much for Seva Canada to help to restore the vision of the poor people in this area for many years. Thank you very much.
To thank you guys, Seva Canada, and through KCCO, to make this happening in Arusha.
Namaste, I'm Shekhar Bhatrai from Seva Nepal, working as a program coordinator. I would like to thank all Seva Canada donors for helping and supporting us as well as our partners. Thank you so much.
Thank you, Seva Canada, for supporting outreach activities and training. Thank you.
Merci, Seva Canada.
Thank you, Seva Canada. We appreciate your support.
Thank you so much, Seva Canada, for your great support.
We appreciate you. We love you.
Yay!
Thank you for supporting Seva Canada.
Hello, my name is